afternoon, and thank you for joining us in Certified Child Life Specialist in the News. In today's segment, we will be focusing on the potential problem of relying on pharmaceuticals as the only intervention when it comes to pain management in children. Our question of the day is, for children in hospitals, how does implementing a music therapy program help with pain management when measured over 4 months compared to children in hospitals that do not have the program in place? As a child life specialist, you are going into the hospital every day to help children have the most comfortable and most enjoyable stay in the hospital that they can have. That mainly includes making sure that they do not feel scared, they do not feel like things are out of their control, and that they do not feel like every time they go into the hospital, they are just facing painful procedure after painful procedure. This is precisely where the ideas of Cain Bailey come into play. All the way back in 1986, he stated that the goals of music therapy are also to assist the patient in remaining a sense of control and becoming actively involved in the management of his or her pain. They said in his article that auditory stimuli helps in suppressing pain. It was also stated that physical and emotional tension can be relaxed and an overall state of relaxation induced by listening to soothing tones. Bailey emphasized the fact that musical therapy was used to soothe and enhance self-expression. Because of this, it is not a one-size-fits-all type of therapy. Each child has their own experience with pain and their own past experience with musical expression. Because of this, each therapy has to be constructed around the child to help ensure that they have the best possible outcome. A more recent study done in 2010 showed that with child patients undergoing the lumbar procedure showed lower heart rates, lower respiratory rates, and lower rates of anxiety when using musical therapy before and after the treatment versus a group of children who did not have musical therapy in place. There are many hypotheses surrounding why musical therapy helps reduce pain levels and helps increase pain management, but a commonly accepted hypothesis is that the music acts as a distractor, helping the children focus on something other than the procedure that is being done to them or other than the pain that they are already feeling. It also appears that the musical therapy increases the S-oxytocin levels while decreasing the S-cortisol levels in the children. This 2010 study goes on to say that in pediatric medical care, non-pharmacological interventions such as musical therapy show promising potential to complement traditional medical treatment already in place for pain management. For a little more support of this idea, an overview of musical therapies and music-based interventions done in 2019 goes over a plethora of different studies talking about musical therapies and the way that they impacted their patients. It goes on to say, with support of a table, that pediatric patients who go through musical therapies or music-based treatments, also known as music medicine, have perceived lower pain levels and higher levels of pain management, along with higher levels of anxiety management, emotional stability, and feelings of control in their environment. For all of the resources that we used as evidence to support our future recommendations that you will hear later on, we implemented the CRAP test to make sure that each of these articles are worth using in our research. So it is CRAP, which would be credibility, reliability, authority, and purpose. For credibility, we look at how long ago each article was made, whether it is recent enough for us to use it in our research, and also, if using a website, how recently was that website updated. So one of our articles was from 1986, and while this was a very long time ago, since it is 2022, we still wanted to use it just to have a basis of how long ago this music therapy for pain management started to be used more widely. Our other two articles are 2010 and 2019, so these are within the last 10 years and they are definitely recent enough for us to use them as evidence to support our recommendation. For reliability, we are looking at, is the content opinion-based or is it backed up with data and research? Are there sources provided, and is credit given where credit is due? And what kind of information is included in the resource? So for our 2019 resource, it is an overview of other research that has already been done by other researchers, and it just basically summarizes what each of these people have found. So while it is not its own research and they are not implementing their own methods and collecting their own data, it is still backed by research, and all of the researchers that they are referencing are accredited. For our 2010 article, it is a study that was done by the authors, and they have their own methods, they have their own instruments, and they have their own data that they collect, analyze, and discuss in the end. And for our 1986 article, it is a short article that basically goes over the premise of what music therapy is without doing its own study. It just talks about the basis, how it should be used, and how people should be trained in order to give this therapy. And it also does reference and source and credit everybody whose ideas that they use. So in these 3 articles, we believe that all of the authors have authority based on their profession and based on the credentials that they have with the schools that they went to. So for our 1986 article, Lucane Bailey is part of the Department of Neurology at Memorial Sloan Kettering Cancer Center in New York. For our music therapy to reduce pain and anxiety in children with cancer, that has authors who are from the Journal of Pediatric Oncology Nursing. And for our 2019 article that goes over an overview of many other research, these people are all parts of different departments of music therapy in the University of Music and Performing Arts in Vienna. And we have a person from the Grieg Academy Music Therapy Research Center in Norway. So all of these people have very professional backgrounds where we believe that they have the authority to talk about music therapy because they have an educational background that they studied for years in order to reach where they are. We would also like to say that these authors have authority because of the fact that all of their articles are peer-reviewed and are published in actual journals that have their own vetting process for authors who want to publish through them. So for purpose, which can also be point of view, we are looking at, is this an opinion? Are the authors biased in trying to push a certain point of view? Are the references cited? And is the author trying to sell you something? So for all of our articles, they are not opinion-based, they are supported by research, they are fact-based. The authors all credit the sources that they are using for their information. There is a works cited page or a reference page or a sources page at the end of each of these articles. And there is nothing that they are trying to sell. They are not trying to sell this is how you become a music therapist, or this is the book that you need to give your patients, or anything like that. They are simply giving their ideas supported by research to say, this is why I think this is a good intervention that you can use. And it may have a little bit of opinion in there because they are saying that they themselves think that it's a good idea, but they also are supporting this opinion with facts, saying this is a good idea because research shows that anxiety is reduced, or because the S-oxytocin levels are raising in patients who have music therapy. So it is definitely not a biased, opinion-based research that we are using. It is all supported by fact, supported by research. Methods are used, instruments are used, data is collected and analyzed. Because of the evidence showing that musical therapies and music-based interventions are helpful in pain management, we are recommending that all CCLS personnel be trained in these therapies. Since these therapies are not one size fits all, it is important that CCLS get trained in these so that they know how to go about each individual's preferences, each individual's qualities, and each individual's perception of pain in order to create the most effective therapy for each child. We also want to emphasize the idea that these therapies are not just for physical pain. These are for emotional pain and mental pain as well. We talked about earlier how they are good for anxiety, how they are good for lessening emotional tension, and we believe these interventions are good for every child who is in the hospital and who is interacting with doctors, nurses, and child life specialists daily. Thank you for tuning into today's segment of Child Life Specialists in the News. We hope you take our suggestions into consideration and that you check out those articles for yourself. We'll see you next time.